Hello, everybody. I'd like to introduce myself. My name is Abdulaziz Athel, an endourologist based out of National Guard Hospital in Riyadh, Saudi Arabia. And I will be sharing a case using a 7.5 French Pusen scope. Uh, so let's just talk briefly about the patient. He's a 65-year-old man, medically free. He was presented with bilateral flank pain, and CT KUB showed him to have bilateral renal stones. The first procedure was a left-sided ureteroscopy done around 1 month ago. The problem we faced at that time was that at the first procedure, the ureter could not accommodate the scope, so we had to stent the patient and bring him later on for a full ureteroscopy. So instead of having a procedure in one go, we had to do it in twice because the ureter was very narrow. It could not accommodate the scope itself. So in the second procedure, we were lucky to have a 7.5 French scope in our hands, and we elected to use it in this setting rather than stent the patient and then go ahead and take him later on for a second procedure. So as you can see in this image, the arrow is pointing at his UO, which is quite narrow from the image itself before doing anything else. So this is what we were dealing with in the first time. We saw this UO and we tried our best to manipulate our way into the ureter. We could have dilated the ureter using a semi-rigid scope, but we elect to put a stent in and then come back later on and do the procedure in a much more natural way. And this is the ureteric orifice with the ureteric catheter being inserted into it. As you can see, comparing the size of these two diameters. And in this image, you can see the ureteric catheter being held in my hand, and comparing on the other side, you can see the difference between the size of the ureteric catheter as well as the 7.5 French scope. I think we're using a 6 French ureteric catheter at that time. As you can see, it's a quite small scope with good imaging. And in this images, you can see the guide wire reaching the upper pole of the right kidney, and the arrow is pointing at the shadow, which is the stone. So it was around a 0.9 centimeter stone. Unfortunately, it was in the pelvis, but I think during manipulation, it was just bumped down into the lower pole. And in the other screen, you can see the Pusen being pushed through the ureter without an access sheath, as we know that most probably the ureter wall will not accommodate an access sheath. And after pushing the scope all the way into the kidney, we can then start our procedure. We typically use 2 wires. One is safety and the other one is working to insert the scope up all the way into the kidney. But some people advocate that the scope itself could be used as a safety guide wire if you're going to be working in the kidney itself. And as you can see, we have a retrograde here showing the anatomy of the kidney. And then in the other image, you see the scope reflected in the lower pole with the shadow of the stone in front of the scope. And this is the setup we usually have in the system in our OR. Having ergonomics is very important to relax your neck, which I am not doing in this image because we were using the monitor to record this video that you will see later on in the presentation, but we usually use the adapter to connect to our own monitors, which gives you a bigger screen. And moving on to the video itself, you can see the quality of the image is quite well, although this is a small scope. We're pulling back from the the upper pole. We already took a look at the middle calyceal system, and after which we're going to go into the lower pole and identify our stone, which I already mentioned was a 0.9 centimeter stone that was originally in the renal pelvis, but unfortunately it was kicked down into the lower pole. And after going onto the lower pole, we can identify our stones, actually single stone. At the beginning, the image was not very good because this was still having some contrast in the collecting system. But after some irrigation, we were getting a better quality image, as you can see. Now we are taking our 200 micron laser fiber. We're using a 30 watt laser system. And we started with a very low settings actually in the beginning, around 0.5 joules. and 12 or 15 actually hertz. I can see the patient, the problem with the moving with the kid with respiration is that the patient had a family history of malignant hyperthermia. So we could not give him GA in fear of him having the same reaction. And we opted to do the case under spinal anesthesia with very high block. The patient tolerated the procedure very well. And as you can see now, we start fragmenting our stone into, and dusting the stone into very fine dust. As we proceed through the case, we had a little trouble with our irrigation system in the beginning, which we addressed quickly. We had to change the TUI Borst adapter that we usually use. It was leaking. And we used the same adapter that came with the scope. And actually, it was quite successful in fragmenting the stone. Keep in mind that this video is fragmented. It's a long procedure. So we took some parts of it and we glued them together to show you an overall picture of what's going on with the patient. And sometimes we just stop to take a look and see what's going on and to do quite some irrigation to see the fragment sizes that we're having. And so once we assess the fragment sizes, we know that we are doing the proper job that we should be doing at the same time. So we usually start with dusting the stones with the settings that I mentioned, and then at the end of the procedure, as you can see right now, we do some popcorning with high power and high frequency just to finalize everything that we have done. And although the patient does not have an access teeth, at the end of the procedure, as you will see, the fragments were all dusted in a very good way, and most of them were flushed out of the lower pole. As you can see right now, this is the lower pole after we have just concluded the procedure. And we will stent the patient. I'm putting the guide wire back in, making sure that it's in the kidney coiling properly. And then I pull the scope through the ureter just to see what happened to this ureter, which we know is very narrow. And fortunately, everything went smoothly. No problems did occur during this procedure. And we'll put a double J stent in place and keep it for around 2 weeks. We'll do a KUB because the stone was radiopaque, and we'll assess whether or not to remove the double J stent at that time. Thank you very much.